This video demonstrates how to use glass pipettes. We are going to show you how to use a volumetric pipette, a serological pipette, and a Mohr pipette. A volumetric pipette delivers a fixed volume of liquid. There are no graduation marks. Instead, there is a bulb in the middle of the pipette, a volume marker line, and the pipette label at the top near the neck. This is a 5 ml volumetric pipette, as you can confirm by the label. This video demonstrates how to pipette 5 ml using a 5 ml volumetric pipette. Inspect the pipette to make sure it is clean and not damaged, especially at the tip. Ensure that the glove fits snugly on your fingertip without wrinkles or folds. This will make it easier to be able to control the liquid level inside the pipette. Hold the pipette with your dominant hand and a safety bulb in your non-dominant hand. Squeeze the safety bulb before inserting the pipette into the liquid to avoid making bubbles. By releasing the safety bulb, the liquid rises inside the pipette. You should stop about 1 inch above the volume marker line. Next, wipe the pipette using a Kim wipe. Position the pipette tip against the side of the original container without immersing it in the liquid. Position the top part of the pipette at eye level and, controlling with your index finger, lower the liquid level till the bottom of the meniscus touches the volume marker line. Transfer the liquid to a test tube. Touch the tip of the pipette against the side of the tube to avoid splashing. Avoid immersing the tip of the pipette in the liquid. At the end, tap once. Notice that a small amount of liquid remained inside the pipette. That's okay. 5 ml have been accurately delivered to the test tube. A serological pipette is a graduated pipette that can be used to deliver variable volumes. Notice that a serological pipette is graduated all the way to the tip of the pipette. There should also be 2 visible hatched rings at the top near the neck. This pipette is a 5 ml serological pipette, as you can see by the label at the top. This video will demonstrate how to use a 5 ml serological pipette to pipette a 3 ml volume. Inspect the pipette and make sure your gloves are properly fitted. Using a safety bulb, raise the liquid above the graduation mark 2 ml. Wipe the pipette using a Kim wipe. Adjust the liquid till the bottom of the meniscus touches the graduation line. Transfer the liquid to a test tube. Make sure the tip of the pipette is positioned against the side of the tube to avoid splashing. Do not let the pipette become immersed in the liquid. Because this is a serological pipette, the remaining liquid must be blown off by carefully squeezing the safety bulb at the top. You want all the liquid to be expelled to the tube without splashing any onto the outside of the pipette. We have just pipetted 3 ml using a 5 ml serological pipette. A Mohr pipette is a graduated pipette that can be used to deliver variable volumes. It is similar to a serological pipette, but the graduation does not go all the way to the tip. It also does not have hatched rings. This is a 5 ml Mohr pipette, as you can confirm by the label at the top. This video will demonstrate how to use a 5 ml Mohr pipette to pipette a 3 ml volume. 1, 2, 3. Inspect the pipette and make sure your gloves are properly fitted. Using a safety bulb, raise the liquid above the graduation line 2 ml. Wipe the pipette using a Kim wipe, and then at eye level adjust the liquid till the bottom of the meniscus touches the graduation line. Transfer the liquid to a test tube. Make sure the tip of the pipette is positioned against the side of the tube to avoid splashing, and do not let the pipette tip become immersed. It is a Mohr pipette, so you must stop the liquid at the last graduation mark. When using a Moore pipette, if you allow the liquid below the final graduation line to be delivered, you end up with more. Transfer the remaining liquid back into the original container. We just pipetted 3 ml using a 5 ml Moore pipette.